Care Quality Commission. Voices into action. Our promise to get people who use services involved in everything we do. Summary version. What is the Care Quality Commission? The Care Quality Commission is all about people. We want to support people to live healthy, independent lives, help everyone to make good decisions about their care. Each person's different needs are met. What is this paper about? To be a modern and excellent organisation, we need to involve people who use services, their carers, families, and friends in what we do. We believe that involving people is important for us to do things right. This paper is our promise to get people involved in what we do. What is in this paper? Our values. These are the basic rules we will follow in our plan to get people involved. We will put the people who use services first, be guided by what people tell us, stand up for their rights and dignity. These rules are based on human rights, equality, and taking what people tell us seriously. Best ways of getting people involved. There are guides that say what the best ways of getting people involved are. These are called best practice. We will follow these guides. What the law says we must do. The Care Quality Commission comes under the Health and Social Care Act 2008. It says that we must look at the needs of people and what happens to them, listen to what people tell us, listen to local involvement networks, links, tell everyone about their rights, write down how we plan to get people involved. Our plan must say how we tell people what we do, ask people what they think about their services and how we do our job, make sure we take action on what people tell us, share some of our jobs with people. Our plan to get people involved. People will have lots of different ways to get involved. 1. Making big decisions. A person who uses services will be involved in making big decisions for us. Working groups help us work in the right direction and give advice on special projects. People who use services will be in these groups. 2. Special groups. These are small groups made up of people who use certain services. For example, a mental health service user group or a learning disability group. We will look at the groups we have regularly to make sure we have a good mix of different types. We will have a special group to advise us on our equalities and diversity and human rights policies. 3. Working together. Experts by experience will be part of the inspection teams and will give advice. Experts by experience are people who use services and include carers. We will use panels regularly. A panel is a group of people who have agreed to let us ask them for their thoughts. For example, we will ask some people on a panel to check if our information is accessible. We will talk to some panels on the internet and some face-to-face. We will involve people in training our staff. 4. Children and young people. We will use special ways just for children so that they can get involved. We will have different ways to get their parents involved at the same time. We will use computers, talk with them face-to-face, and in places that they feel comfortable in. 5. Surveys and studies. We will have regular surveys to find out what services have been like for people. We will ask people to tell us what surveys we should have and to give them out. We will make more ways for people to tell us what they think whenever they want. 6. Talking to people and giving information. We will print information about ourselves and send it out to as many people as possible. Everything we write will be set out clearly in simple English. All our information will be in different formats, like EasyRead. It will be easy to get in touch with us through our call centre. Staff will be trained to talk to people in different ways. Inspectors and people who do checks will be trained to talk to people in different ways. Our website will be easy to use and will have information about what people tell us, how people are involved, the services we check. 7. Asking people what they think. When we ask people to tell us what they think, we will make sure we include groups that are left out a lot. We will use organisations like the Speak Out network to help us do this better. We will hold our events as close to people's homes as possible to make it easy for them to take part. We will involve people in planning our surveys to make sure the questions we ask are useful to them. We will use different ways to ask people what they think, like online surveys and chats. We will also talk with people, face-to-face, in small groups and meetings, events. We will check the ways we talk with people to make sure we are using the best ones for them. Using what people tell us. We will use what people tell us to make our policies, decide what we should do next, plan how to do our work. Each department will write about how they have used what people have told them to do their work. We will look at what people say about services and use it in our checks. We will make sure that people are involved in all our plans. We will tell people who got involved what has happened because of what they told us. This is called feedback. Checking how well people are getting involved. We will check how the services we are in charge of are doing at getting people involved. We will check how they use what people tell them in their work. We will use different ways of checking, like surveys that ask people what a service was like for them, ways that other people have come up with for checking what services are like for people, work with local involvement networks, links, sharing what they know and involving them in our checks. We will use what experts by experience tell us about equalities and diversity and human rights to write the involvement rules for services. Sharing our work with people. We will look at sharing our work with people and volunteer groups. This could be giving people a bigger say in service checks, asking groups to look into things for us, helping us make better ways of checking. Making sure it happens. Letting people know about us. We will use lots of different ways to tell people about the work of the Commission, like newspapers and magazines, internet, TV and radio. Working closely with other organisations. We will work closely with volunteer, user and carer-led organisations. We will support groups who need support to help them take part. We will make sure that the way we ask people to do work for us will be easy to understand for user-led organisations. Staff for getting people involved. We will have a team who will just be in charge of making our plan for involving people happen. We will make sure that they will get the right support to do this. Staff working in different parts of the country will work closely with links. They will also get to know and work closely with other organisations that act for groups of people. Staff will be trained in how to include lots of different people. Money. People will get paid for getting involved in some things. We will respect the rights of anyone who does not want to be paid. We will make sure that money is set aside for getting people involved. How will we know that our plan is working? We will know we are getting it right when we can tell people that what they said has changed things. We get a lot of people taking part. We work well with user and carer organisations. Our reports on services are like what people say services are really like for them. We will see it in the services we check when they give excellent care, people are happy with them, lots of people are involved with them, they get better because people are involved, newspapers write good stories about them. We will have a list of checks that will show us how well we are doing. These include getting a good mix of people involved, people being given feedback about their involvement, giving enough support so people can get involved, departments are using what people tell us, the ways we get people involved are good. We will check our action plan regularly. We will see whether the services we check have been changed by people getting involved. What we think should happen. Organisations that plan and buy services know more about people who use services and what it's like trying to get services. Organisations know what it is like for volunteer groups, especially groups that act for service users and carers. Services are more open about how they make decisions. They are more willing to tell the public why they do things. People that run services talk more with people who use service users and the public about what they think and what is important to them. People that run services work more closely with the experts in the community. They use what they know to plan their services better. Telling people what we have done. This plan is part of our work plan for the whole Commission. Anyone will be able to read it. We will put updates on our website. We will write about what we have done in our big yearly report. The government will check how we are doing to make this plan happen. We will check our promise regularly to see if anything needs to be changed. We will take a very close look every 3 years to see if we can make it better.